This work is exploring the introduction of new and emerging technology for adult social care using the example of remote sensors with artificial intelligence technology. It's produced by the RACE team, the Rapid Evaluation team at the University of Birmingham and RAND Europe. So just as some background, as I'm sure many of you are aware, the social care system in the UK is under unprecedented pressure from an ageing population, a shortfall in funding and a shrinking workforce. Technology-enabled care solutions are widely expected to meet some of this increasing demand. However, evidence of their successful deployment in social care settings is mixed, and there are many questions to be answered in terms of how social care services plan and implement the new technology. This work is going to explore how a number of care services selected and implemented a particular example of AI-based smart sensor technology produced by a company that we are pseudonymizing as Independence Plus, with the intention of informing future policy and practice. Data was collected by a series of remotely conducted semi-structured interviews with senior and frontline staff at 3 care sites, as well as a representative of the technology provider and their trade organisation. We used a guided content analysis to analyse and present the data, the NAS framework. So this is the non-adoption, abandonment, scale-up, spread and sustainability framework, which has been developed to help plan the implementation and rollout of technology and offer a structured way of learning from previous experiences. A brief summary of what we're referring to when we talk about sensor-based AI technology. So essentially there are 3 aspects to it. A series of monitors placed around the home of the expected beneficiary. These record physical activities, whether you put the kettle on, open the fridge door, if you've left the house, as well as a number of physiological parameters, including heart rate. All this data is then collected by a smart hub, again within the home or care setting, and the data from that is then passed to the AI server and software, where the data is analysed and baseline patterns are created over time. And this allows the AI to detect changes in behaviour which might otherwise have been missed, and so the care provider, via the data dashboard, can observe these changes, or attention is brought to these changes, and they can respond accordingly. With regards to a description of the case study site, so there were 3 sites that took part. Social care provider with a number of care homes around England and indeed Scotland. There was a local authority in a rural area and a local authority predominantly situated or predominantly covering an urban area, though with some rurality. A total of 23 interviews were conducted. So an overview of our findings within the 7 domains of the framework. So firstly, with regards to the condition with which the technology was due to be used, so it was designed and expected to promote independent living. However, there were issues both with the digital infrastructure for some of those individuals and acceptability, and that it was noted that there was in fact a lack of consultation and engagement with frontline staff as to what actually might be useful and applicable. With regards to technology, it was difficult to install and maintain, and also there were issues around with the data dashboard with this user interface, which made analysis difficult. The value proposition in terms of what was expected to achieve, as we've touched on previously, there's a lack of reliable evidence in order to inform sort of decisions on which pieces of technology to select or are most appropriate, and there was also a lack of expertise on behalf of the care providers in terms of making informed decisions on what would be the most appropriate technology. With regards to the adopters, so we're talking about here primarily the staff, it required a fundamental change to some roles and the acceptance of additional responsibility in terms of monitoring the data produced, which was an issue. There was also a lack of digital literacy amongst the workforce, and again, that had to be worked through. From an organisational standpoint, there appeared a lack of a systematic implementation and/or evaluation process, though acknowledging there wasn't a huge amount of data to analyse and use because of the unreliability of this particular piece of technology. However, there is a need for a wider retraining or upskilling of staff in terms of using digital tools, as well as indeed improve the infrastructure at some of the sites where it was noted there was not even a working computer present. With regards to the wider system, we've touched on the fact that technology is widely expected to solve a lot of the problems. However, there isn't a whole lot of evidence currently present, and we also noticed issues of trust with some of the end users and the public around the privacy and the security of the data. And finally, if we are expecting to embed some of these changes over time, there needs to be a cultural shift in the way that people approach care from sort of a short-term, almost crisis management towards long-term preventative care. Just a few observations to finish. There is absolutely, we want to make it clear, there's no implied or intended criticism of the sites involved. This was very new technology, and so absolutely they were some of the first and deserve some credit for actually sharing their learning with us. Many of the challenges we faced with regard, or the sites faced with regards to the implementation of the kit have been seen before. And so it's important that these are addressed now, so that the next time that somebody looks at this, we don't again learn similar lessons around the barriers to implementing technology in care environments. And it also needs to be addressed is about what exactly happens to the data, who is responsible, and how is that looked after. The final report will be published by NIHR. There's links there to our websites, and there will be a peer-reviewed paper, hopefully appearing in the near future. Thanks very much for your time.